Great. Okay, well, I think we'll get started. So good afternoon or hello, according to the time zone that you might be in. My name is Karen Gottfried. I'm joined by Amy Bartlett. We're two of the organizers of the Ottawa Psychedelic Education Network, which is affectionately known as OPEN. So we're really honored to have you all here and to join us with two respected elders in our community, Catherine Kimball, and of course featuring psychiatrist Dr. Paul Grof, to share some of his ideas and learnings and wisdom with us today. So just to begin, we want to acknowledge that we're broadcasting from here in Ottawa, and this is the unceded and unsurrendered territory of the Anishinaabe Algonquin people. Their presence has reached back here since time immemorial, and we move forward with this event with gratitude and with humility. So we'll start today to give you a bit of a sense of the order of events. We'll give you a brief introduction about our community, a bit of a bio about our speakers, and then we'll launch into the interview. We're going to leave plenty of time for questions. They might come to you while the discussion is happening, in which case you're welcome to drop them in the chat. Amy's going to be monitoring. So you could put the word question before, and then that signals to us that it's a question you want to bring up to the Q&A later. You'll also have the opportunity to ask your question live if you prefer that way. So we just want to make sure that however you want to participate, you're able to. A bit of housekeeping to please keep your mic on mute so that if you have like a loud cat in the background like mine, that doesn't have to get broadcasted to everybody. And also encourage you, if you'd like, to put the Zoom into speaker mode so that you can see highlighted the speakers who are talking, but of course, up to you. So I think that's all I have in terms of the housekeeping, and now I'll turn it over to Amy to tell you a bit about our community.
Thanks, Karen, and lovely to see everybody this afternoon. Lovely to be here with you. I see lots of familiar faces, so this will be a bit of a repetition for people, but just to catch everyone up and to welcome all people, both the people who are a part of our community and people who are curious about psychedelics and non-ordinary states of consciousness. So this is the Ottawa Psychedelic Education Network, or OPEN. And basically, we're a safe and supportive community for those interested in psychedelics, entheogens, plant medicines, plant teachers, and non-ordinary states of consciousness. We have a big commitment to community engagement, fostering discussion and education on the nature of psychedelic experiences and their potential for healing and personal transformation. And by focusing on those, we really hope to break the stigma around psychedelics and those who use them. Our events provide opportunities for members to explore, to learn, and to share one's own experiences with psychedelics and non-ordinary states of consciousness, and create opportunities to be in a supportive environment where you can feel comfortable sharing the insights, questions, the impacts, and the challenges that are generated by these kinds of experiences. We place a strong emphasis on harm reduction as part of psychedelic use, and we encourage the accessible and safe use of psychedelic substances. So that's the spiel, and that's our community, and we're really pleased to have you all here today. If you want to get more involved, you're welcome to find us on Facebook. And in addition to today's event, we have weekly online discussion circles and integration circles to join in on the conversation and connect with others. So we hope to see you there. Thanks, everyone.
Well, thanks, Amy. That's really great, really helpful to situate us in the work of the community. And now I'll just take a moment to provide some brief bios about our two esteemed speakers. So first, to tell you a bit about Dr. Paul Groff. He's a psychiatrist who's been involved in the treatment and the research of mood disorders in Canada, the United States, Germany, and the Czech Republic since 1959. Most recently, he served as the director of the Mood Disorder Center in Ottawa, and is the professor of psychiatry at the University of Toronto, Ontario, Canada. He's authored or co-authored over 400 papers and 3 books, and he's also led at the Royal Ottawa Hospital, the National Institutes of Mental Health in the United States and the Czech Republic, and has advised as an expert at the World Health Organization in the mental health section. So we're very, very honored to have Paul with us today, given his wealth of experience. And we're equally honored to be joined by Catherine Kimball, who's one of the founders of Open. I want to share with you a little bit about her background and what brings her here. So Catherine Kimball, as one of the founding members, wants to share that a few years ago, at the age of 77, Catherine first heard of psychedelics discussed on CBC radio and immediately knew that this was what she had sought all her life, a path to the transcendent, helping others on their unique paths and exploring her own mind and spirit is now the joy of her life. So with that, to situate this conversation in the relationship, the connection between Catherine and Paul. Catherine, I'd love if you can get us started by sharing a little bit about how it is that you came to first meet Paul. Over to you.
Okay. About 2.5 years ago, the University of Ottawa hosted a conference on psychedelics at the end of life, which I attended. Among the guests introduced was Dr. Paul Groff. Well, now, I had learned about this man from the works of his brother, Stanislav Grof, his books and videos, and I knew about the role he had played in this famous first ever LSD trip by Stan Grof in Czechoslovakia 64 years ago. So I guessed that this brother Paul would have many interesting things to say also about psychedelics from his unique perspective. And here he was living in Ottawa at this conference. So I kind of pounced on him and identified myself from our community of Open and said, would he come and meet us and speak with us? Well, he said, yes, sure, he did. So 1 year later, we had our first conference in Ottawa on psychedelics, collaborating with the Santo Daime community in Montreal. But within months, COVID reared its head, and you know what that did to us all. So at last, we have our second encounter with Paul. And this time we will ask him to talk more about his broad-ranging experiences on psychedelics and beyond. And so we will pull some stories out of him. And I discovered he's not one who readily talks about himself. So we're very grateful that he's made himself available, and we're grateful to Zoom that makes it possible. Thank you, Paul.
Oh, thank you, Catherine. Well, you've been into psychedelics and non-ordinary states. You should know that when you do that repeatedly, you lose your ego, and so you lose your personal story. How can you then talk about it? That's a problem. Anyway, many thanks all of you for being here. I mean, this is a long weekend in Ottawa, the first one for the summer. And I'm just absolutely amazed that so many of you are taking time, particularly at lunchtime, which is a family time. So thank you for being here. I hope it's going to be worth it for you. But to start, I just want to thank wholeheartedly to Karen, Amy, and Catherine for setting up the Open a number of years ago and running it with full dedication. We are in the era of psychedelic renaissance, and the education is an essential element to make sure that things keep going in the same direction. that they do not derail as they did in the past. And so you are doing very valuable job, and thank you for the discussion group, for the integration circles. That's a wonderful, wonderful activity.
Thank you so much.
A safe, comfortable, confidential space for people, and that's what's needed.
Well, thank you. It's a true privilege to be able to support these events. But I think you're doing some foreshadowing, so good job, Paul. And I'll turn it over to Catherine to ask the first question. Let's hear what she's going to ask about.
The first question is on witnessing. Paul, you have been both a participant and a witness to some important events in the psychedelic emergence and re-emergence in the West. Can you share some anecdotes of this participation and witnessing?
Well, that's not a simple task. I certainly witnessed the unfolding of the psychedelic history and participated in it from the beginning. And it was very exciting, very educational. And at the end, where the repressions came, of course, very frustrating, because at the time when the activities should really start and research should have started, everything went to the arrest. And it's not easy to choose just a few anecdotes, few stories. There was so much. I mean, we started, let me just kind of try to sum up. I mean, we started with wrong assumptions. We assumed that we're going to use LSD as a model psychosis that will then treat with neuroleptics and figure out how to do the treatment. Of course, that turned out to be a mistake. Then Stern's first session certainly, from my perspective, I think needs to be talked about. Then our work with volunteers, our work with training people to use LSD in treatment, using it for staff, for education. And after this almost a decade of LSD being readily available in the pharmacopoeia next to penicillin and aspirin, coming to the States and Canada and seeing what there has been happening, completely different scene, and the hippie scene, and then eventually the Nixon repression, and meeting so many of the leading personalities, Tim Leary, Baba Ramdas, Ralph Metzner, John Lilly, and of course in Canada, Abe Hoffer and Humphrey Osmond. And finally, the involvement in the stories in the World Health Organization. So there's lots to talk about. And I'm not even going to touch the context, the century of nonsense, the war on drugs. So let me just try maybe to take one story from the beginning, one from the middle, and one from the end, and see how that goes. And then, of course, if there's time later, people can kind of nab me down to other stories. Many of you probably who've read Stan's book know his description of the first session and know the depth of it and know what happened. From my perspective, there are several interesting points. One is I did not know that the historical event was happening. The psychedelic experiences cannot be put easily in words. They are ineffable. And he described to me how amazing it was, how he was catapulted into the universe and the power of the experience. But I had at that time, I really had no context, no way of capturing it, no experience of my own to be able to participate in it. And then, of course, I could see the tremendous impact on his life, how he spent several years just essentially locked in the institute and coming home every 2 weeks just to get the fresh underwear, and otherwise just kept running sessions and exploring. But for me, I think the interesting aspects, I really only became fully aware of what happened 64 years ago, I guess. About 3 years ago, when I was invited to San Francisco, and the University of California in San Francisco arranged kind of several days celebratory sessions of Stan's work. And that was an eye-opener, because there were speakers after speaker after speaker coming and talking about what Stan's work with psychedelics and with holotropic breath work, and sharing his understanding of that, what kind of impact it had on people, on their lives, on their work, on their involvement, on their work with clients and patients. There were people describing what happened in South Africa as a result of participating in holotropic breath work. They started changing the relationships between genders, started changing the relationships between races. They changed some laws as a result of what they learned in holotropic breath work. There were people from Russia. There was 100 centers of holotropic breath work developed in post-communist Russia. There were a number of people from the States talking about their impact. So it was only then that I fully realized what I witnessed 64 years ago. And I think there were some synchronicities at that time that became obvious later. One was the mentor, the Stan's, the Professor Rubicek, who provided LSD came from Sandoz, of course. He was interested in electroencephalography, and that was a new kid, a new machine in psychiatry, and one of those laboratory instruments that then later, every new instrument was the hope that the laboratory and machines will resolve the questions of psychiatry, which of course never worked. But at that time it was EEG, so everybody on LSD had to have EEG. So they put Stan on EEG, and he used activation of EEG by stroboscopic light. And this is a flickering light, very bright light. And I think that played a role that I think tremendously magnified Stan's first experience. And so that was these kinds of things that I think in retrospect, I can think about. The other particular, I think, from the middle of the activities, the way the volunteers, the way the people who would be working with clients and patients were trained was interesting. And it was based on psychoanalytical model. Now, some of you have heard, if you want to become a psychoanalyst, you have to undergo psychoanalysis. So if you wanted to become LSD therapist, you had to have 5 sessions of LSD that were supervised. And then you had to work with 30 patients under supervision before you were able to prescribe LSD. But then from then on, it was just a prescription, and you could go to the pharmacy, patient could go to pharmacy. If you wanted to be a volunteer, you could go. There were several research institutes that ran studies with volunteers to investigate the effects of LSD on a variety of metabolic and psychological impacts. And I think this is so critical, and we are now trying very hard. We are working with Health Canada, for example, trying to develop some guidelines for using LSD or using psychedelics, not specifically LSD. That's not a good way to start politically. Using psychedelics, that the therapists have to experience non-ordinary state of consciousness. Now, whether it's going to be with psychedelics or not, or holotropic breath work or whatever it's going to be, but imagine if you went and asked somebody to teach you to drive the car, and he would say, "Oh, I've never driven the car, but I can teach you. I read about it." This would be the kind of story. So I think it's very important that if somebody uses whatever it is in a medical model or outside of it, that they have personal experience with the particular tools that they will use. Some of you might be interested towards close end of the story, meeting Tim Leary, actually. That was interesting in '68. We had a lunch with him, and the big question at that time was, we're still, I think, struggling with psychedelics being so different from other drugs, where if you have a drug and you know the dosage and you know the person, you can predict to some extent what the response is going to be. But with psychedelic substances, you don't. It's going to be different from session to session, and there's a number of interesting factors in that. But we thought it would be Leary would be a good person to ask about that at that time, and he said, "Oh, I had over 1,000 sessions on LSD, and every session was different." Well, there were some similarities here and there, but the play of consciousness is so rich that it was elaborate. Maybe towards the end of the story, I should mention, if you want, at least 3 stories. The involvement with World Health Organization was very interesting. Recently, World Health Organization was criticized for how they handled the pandemia, that they did not start in time, that they did not explore properly the Chinese situation, and all kinds of things. People just don't know how difficult the situation is in World Health Organization. First of all, limited funds. At that time, when I was there, most of the funds actually from the United States. And Russians had to be involved in for representation, but they have not ever added any cents to the activity. If you think about bureaucracy, if you know governmental bureaucracy or university bureaucracy, you would not believe what that was like in the international level, how difficult it was. And so I was absolutely amazed how much actually people were able to achieve in this difficult bureaucratic situation. I think they made me the chair at that time because we just really achieved the battle over lithium, which finally was accepted as a mood stabilizer. And that was a hugely controversial issue, and eventually it happened. So I think for that reason, I think I ended up as a chair. And this committee was 25, 26 people, and was really set up so much on focusing on what's wrong with psychotropic drugs. The committee had to evaluate every substance, write a report, and then send it to Social and Economic Committee of the United Nations for the international agreements. But my impression was I was really the only really practicing psychiatrist. There were 3 other psychiatrists, but they were, you know how it is. They had to represent a few countries. You can imagine how that goes, the choices. And then the rest was Interpol, police, criminal staff, toxicologists. And they made the decisions about how the drugs are going to be. And it was very frustrating because the activity of the committee depended very much on what kind of substances or what kind of abuse of substances was reported. So you could have from one particular country 6 abuses of one particular derivative of amphetamine, and we had to deal with that for 2 hours. And I thought, God, we should be dealing with real problems. We should be dealing with alcohol and nicotine. And when I mentioned that, the Russian delegate got up and said, if you touch alcohol, I'm leaving immediately. This is nutrition. I suppose you know that at that time they had about 25% problems with addiction, alcoholism. So this is like it went. And then MDMK, we reviewed it. And of course, everybody on the committee said, Schedule 1, MDMA is out, ecstasy out. And I said, look, if we do that, then there are very promising observations and experiences in depression, in working with marital counseling, in PTSD. This would all be killed if this doesn't make sense. No, ecstasy is out. And I said, I'm not going to sign it. And it was interesting. I did not know at that time that all over the years, I guess for political reasons, you could not send something to the United Nations where there were 14 for 16. It always had to be full agreement. And in many situations it was possible, but there couldn't be any voting. So if we did not agree, they could not do anything about it. So they brought in 3 lawyers, and you know how it goes on one hand, on the other hand. So an hour and a half later, they finally came up with a suggestion that I can write an opposing statement. And that's how it eventually came out. And Rick Doblin tells me that that's how he was eventually able to get the MDA testing. When the MDA is approved, I don't know whether it's going to be in the fall, whether it's going to take longer in the States and a little bit later probably in Canada. I mean, some of these things will be reactivated again. Catherine, how am I doing for time?
Well, you've got more time yet, but I wondered if we should move on to the next question for a slightly different topic.
Up to you.
Well, I obviously we don't have more than a fraction of the time that we really need. I'm going to suggest we move on to the next question, which is on consciousness. Which is the subject of consciousness has played a major role in your career through the transpersonal, psychosocial, and biological lenses. If you have to provide some broad highlights, what would you say you've learned about consciousness in your life?
Well, I am afraid this is going to frustrate you to no end. I'm going to say that we are at the bare beginning of really investigating how human consciousness works. And let me try to explain it, why I feel that way. As you know, the dominant assumption is that human consciousness is somehow, some way created in the brain. And there's no question, brain plays an important role in human consciousness. But there is really no evidence that I know of that would really demonstrate that it's all created in the brain. There's a lot of theories. Some are pretty bizarre, but that's the way it is. Usually it ends up with the statement that the consciousness is an emergent quality. By that, I think what they mean is if you take hydrogen and oxygen and put them together, then water is an emergent quality with different kind of behavior than oxygen and hydrogen. but what does that say about consciousness? And I think the problem started really with the early studies, because when people asked first the question, how the consciousness functions, it was studies of injured brain and diseased brain that they investigated. So let's say the famous story of Phil Gage, 1848. He went to work and a big metal spoke went through his frontal lobes. So that started explaining these changes in the behavior and social behavior and thinking and so on, started explaining what kind of role in human consciousness frontal lobes. And so it went. And of course, there's some very sophisticated studies, but the problem is always you have to have the right assumption if you study something. That's one thing I was surprised. I learned in research. I thought you could research anything, but you can't. You have to have some initial hypothesis and some formulation, and you can go completely in the wrong direction. I mean, you always think about these funniest situations where people were convinced for 2,000 years that the earth is completely flat, and what kind of questions they investigated, like what is going to happen at the end of the earth with the water, and those were the big questions. And so you can of course learn quite a bit with this approach about the brain, but it's I'm also imagining if I was asked, if I come, somebody gives me radio and television and I don't know anything about that, and they tell me how it functions, and I'm going to use the usual mechanistic approach, take some parts out and try to figure out and break one and see how that changes. It will make changes, but will that really tell me about how the television really functions? And so let me make the story. I think we agreed. I promise that I'm not going to talk too much about the research because that would require slides, but I'm going to summarize that. In the studies that we and others did, there are three things that I think are important. Now, in the programs we had over 5 decades in mood disorders and studied these conditions, indeed, we found out that in non-ordinary states of consciousness, such as major depression, major mania, there are significant changes in the brain, in genetics, neurobiology, psychology, neurophysiology. But I could give you a list of the neurochemistry changes. All the significant ones are in the same direction, whether the person are experiencing depression or mania. They're going in the same direction, whether you're experiencing hell of depression or, as some people describe it, elation or heaven of mania. And then the second thing is, because of genetics, we started looking at large families. Some of the things, bipolar disorders, the classical bipolar disorder tends to cluster in families. So it makes good sense to study families. And over 35 years, we've had a number of families where we eventually saw 100, 110 people, and proportion of the family had emotional problems. So we investigated all of them. And all these people eventually clinically and from the investigational point of view had the same type of problems, abnormalities, neurobiological abnormalities, but they were experiencing completely different things. One of them had bipolar illness, but the rest of them would go all over the DSM-3, the Bible, diagnostic Bible. So how could that explain? And the third thing was brain imaging. If you take psychedelic substance, what was particularly studied so far has been psilocybin in England and LSD. what happens is what I should go back to ego, actually, because that's the MN, the default mode network that's supposed to be connected with your experience of ego. The filtering ability gets hugely reduced. So suddenly lots of things can come from outside of the brain. You know, normally we experience very narrow aspect of electromagnetic spectrum. In our hearing, in our seeing, we see very limited. But when this opens, the filter opens, you get much more in. So when you put this together, these three things, I think it's very compatible with the hypothesis that, for my colleagues, is unfortunately very radical and difficult to swallow. But it's both the brain and the brain as a local consciousness and non-local fields of consciousness that work together with the human consciousness. At least that's one of the ways I could explain what we've observed over the years. There's a cooperation, and the brain creates some of the conditions. Certainly, when your oscillatory activities are high, the activity is high, you are more prone to non-ordinary states of consciousness. Certainly, brain plays a role in timing and intensity of it will influence it. But it looks to me that it's more likely, more easier to explain all the experiences that are coming, that are actually coming from some field that surrounds us. And from that angle, we are really just at the beginning. I mean, why you go to a holotropic breathwork session, or you take a psilocybin, and 1 week you're going to have wonderful experience, and next week or next month you're gonna be dealing with the night of horror, or dealing with depth of some depressive experiences. We have very limited understanding how the consciousness makes these decisions, how it plays it. So I think there's much work, and I envy you people. I'd love to have another 50 years to know how this story is going to unfold and where it's going to lead, and what it's going to say about the play of human consciousness.
Well, if I can ask you one quick question so that everyone's on the same page, can you tell us what you mean by non-local, for those who might have not heard that before?
Well, non-local means essentially what you perceive when it's not coming from your senses, from your hearing, smelling, and so on. That would be the main characteristic. And the assumption is because in non-local states, you have all kinds of abilities that are outside of senses. You can have intuitive experiences. There's evidence for telepathy. There's evidence for a number of other psychic experiences. It appears if it happens, let's say, between people or between the person and some object, some information outside of the brain, that it's non-local. It's not in the brain. It's coming from somewhere else. And the assumption is, there are several major discoveries that have been that emerged from hard sciences over the past century, from quantum physics, from astronomy, from geology, from biology. One of them is there are many more fields. Everything is more complex than Newton would assume, but also there are many, many more fields. And so the assumption is that there is also a field of consciousness from which we will be getting these experiences. and from which you would be getting intuitive input, from which you would be getting telepathic input. Because it's new, it's not easy to grasp yet.
This may be the time to move into the third question, which certainly is related, but it's on your life path and consciousness, Paul. Some people feel that life presents us with opportunities to learn through experience about the things we've been put on earth to do. How has your exploration of consciousness intersected with your own life personally?
That is an intriguing question, indeed. And if I read you correctly, then this is based on the assumption that each of us in some way is either given or discovers task or set of tasks for the life that are central. And then life creates opportunities for us to deal with those tasks. And that concept in general kind of resonates with me, but I have a feeling that the story is actually much richer. And I think in the last 5 decades, people collected a lot of information that suggests or makes it possible to create much more interesting, richer story. But if I should talk first about, before I talk about it in general, about my life, yeah, I came to the conclusion that my main tasks for my life have been to help and serve people and explore human consciousness, get some better understanding of human consciousness, and hopefully some of that is happening as I just talked about it. Well, there were two big camps of opportunities for me, and one of them was definitely having Stan as my brother, and you know, all that learning and connection. He's been a wonderful brother throughout life. We were regularly in contact, at least a couple of weeks, sometimes weekly, Skype and phone, and I would go to California at least a couple of times a year. He would occasionally come to Canada, and that was learning. That was an opportunity to learn directly about the transpersonal and much more deeply about psychedelics, because he was much more regularly involved in that area. The other big camp for me was the investigation of mood disorders. I feel I just have had such exquisite opportunities to do that, to study depression, mania, and the normal states in between. It was amazing. I was always able to set up my job in a way I wanted it. I would come to McMaster and they would let me set up the program the way. It would come to Ottawa, and after I got off the administrative job, I was able to set up program the way I wanted, following some people for 40, 45 years, being able to work with all their families. We had separate team that worked with the children and grandchildren, and learning things that are very new and very useful, looking together at neurobiology, psychology, and transpersonal aspects. It was, I think, an exceptional opportunities, like a chain of wonderful opportunities. I should say, however, that, you know, this happens to people. When when people mature, I have to put it, no, when people get older, very often you look at it and you have a feeling that the life was somewhat designed in a way, like you mentioned, the kind of some trajectory, that it's been in some way created or co-created, and then the opportunities come. But sometimes life has a difficult task to actually keep you on that trajectory. You know, a number of memories come back. I remember, for example, how obviously when I mentioned what my task was, it was helpful to be a physician. You just get a bit more trust, I think, when it comes to dealing with help. But it was difficult to keep me on that. For example, when I applied for medical school, you know, they told me, look, yeah, you have excellent marks, but that doesn't mean anything. Your grandfather owned a small department store and your father is engineer. You are bourgeois, you are anti-communists, you know, we don't need these guys. They were actually taking people into medical school, certain percentage right from the factories. They gave them summer high school just to have the right people. So they said, you know, you have practically no chance that you. There was 4,000 applicants, 200 positions. So I get there, and there's 20 committees. 19 of them, you know, the life has a really hard time to keep the opportunities. There were 19 of them staunch communists as a chairman, and there was one like a token non-communist old professor. And I got assigned to him. And he starts asking me, all the questions were about medical physics and mathematics, so that the people from the committee really could not participate in that. I'm pretty sure he pushed me through. And what happened later, I found out that this professor before the war was good friends with my parents. My mother used to come. You know, those kind of life sometimes has a hard time to keep you on the trajectory. And there were so many other, I mean, working with Elmer Green and Jack Schwartz and the intuitive group. So many opportunities. There is one interesting thing about that. Over the number of years, the discipline has learned from people who have near-death experience. They have learned from people who are evidential media. And we've learned a lot, partly, I guess, thanks to Stan, from people who went deeply into non-ordinary states and explored and came back with the story. And so if you put the near-death experiences are particularly interesting. There's no material. If you want to read about that, Van Lemmel, that Dutch cardiologist, did fabulous studies about these near-death experiences, proving that the consciousness is clearly out of the body. And the Virginia psychiatrist Grayson has collected, for 50 years, has collected near-death experiences. If you put these things together, it appears that when you leave the body, whenever that is, you go there, and eventually the time comes when you had enough to be in unified field, for whatever reason. Maybe you want to come back and have all these adventures that one can only have in the body, whether it's, for some people it's food, for some people it's sex, for some people it's other things, but obviously something brings people back. And according to the description, what happens, you meet with a group of spirits, ghost spirits, guiding spirits, guardian angels, whatever. Anyway, they come together and you negotiate. So you kind of co-create, co-produce, co-design the trajectory, going back to your question, the trajectory in life. And then you come, according to the description, actually I experienced that once, the time of your conception is very much determined. There's a cosmic law that determines exactly the split of the second so that it fits. And then you come to life, and there is trajectory. You have options, and then you have to decide on these options. And the critical thing is, do you decide from your heart when the next step comes? Do you decide from the compassion? Do you decide from the caring? Do you decide from the love that you experience? Or does it come from some other things? And then you move on the next step. And this makes sense to me for things like when we looked, for example, at premonitions. You can see that certain things, certain options like multiple choice are there. And if the intuition gives you the possibility to see what's coming, let's say a tragedy, you can avoid it. If you listen to, and if it's true perception. So that idea of multiple choice, where you decide, and it depends from where spot inside you it happens, is very important. So it's probably a longish reply, but I hope you see why I see that question in a bit broader context, richer context, more colorful context.
Oh my goodness, your answers leave me hungry to hear 10 times, 20 times more from you. But there is
read Grayson. There's
okay, yeah.
It's not from my head.
I think there is a time now for me to ask the last of my questions. I think it's time to turn back to Karen for her to now begin with taking questions from you. So Karen, I turn over to you now, if that's appropriate with you.
All right, then.
You agree,
Thank
Karen?
You have ceded your last question as an act of generosity to the group. So
yes.
The way we'll unfold now is we have noted the questions that I've put in the chat, and I'm going to go back and forth between asking one from the chat and also checking with the group if anybody wants to ask one live. Friendly reminder to follow in the footsteps of Catherine's humility. So if you have a question, to make sure it's a kind of concise question, to make space for anybody else who might have a question. And we can always continue the conversation at one of the discussion circles as an idea.
Oh, yes.
So the first question is, well, Justin has then just dropped it, but it's on the top of my list already. So I think people might be interested. And maybe I'll actually fuse two. So Justin had asked, you mentioned, Paul, in the early days of being able to describe LSD after training and supervised patient support, what were the doses of LSD that were being prescribed at that time? And then David had asked, what were some of the integration approaches used in the early days of LSD therapy that you described? So perhaps we could look at that as a whole in terms of the protocol of dose and integration.
Yeah, well, at that time, we did not know, so we were obviously experimenting. And usually the lowest dosage was 100 micrograms. They were in more kind of psycholytic. Some people get 300, 400, 500 micrograms. And there were some people with kind of severe obsessive compulsive disorder, which sometimes has complex background to it, and you may have to go higher. If I remember correctly, 600, 700 to try to break through. So now, keep in mind that when we worked with patients, with clients, this was always part of the therapy. These people were in continuing psychotherapy, and so the integration was essentially part of whatever happened after the sessions. And often I think particularly Stan ran some series of treatments where people could have had 10, 15, 20 sessions, and there would be integration after each session. It's probably, I'm assuming that your question probably comes more from situations where somebody has one or two sessions, and then of course it's important to schedule specifically the integration and discuss it. But we were operating more in the model where that was part of psychotherapy, speeding up, deepening the psychotherapeutic, the exploratory process, find out where the pain, where the suffering is coming from.
Wonderful. And that actually leads to an interesting question I'll ask next. In the meantime, if folks want to ask a live question, please feel free to click the participants icon, and then there's a place where you can click raise hand, and that's how we'll know that you'd like to ask a question. So in the meantime, to follow up on that thought you just offered, Paul, folks are asking about how they might use psychedelics for mental health. So Bev had asked about, have studies proven that psychedelics relieve major or minor depression and reduce addiction challenges? And Rosalind had asked, how might one supervise, for lack of a better word, the use of these substances if the person supervising is not experienced with the substances?
Do you think we could go one question at a time?
Yes.
Yeah. There is quite a bit of evidence, but before I say that, you have to keep in mind that it's been extremely difficult to study the efficacy of psychedelic substances because they haven't been legal. I mean, you know, what I think was possible, I think where things start, well, there was in the Maryland Psychiatric Research Institute still, I think from 1968, if I'm not wrong, about 1971, I think the studies still continued, and I think they focused a lot on addiction and alcoholism, and that was quite effective. They were using, I think, fairly high doses, 300 micrograms, if I remember it correctly. But again, it's not a question of what the drug does. This is a different situation. I think what we need to know is how effective are these substances when they are provided as part of psychotherapy. Now, we don't know enough. I mean, yes, it happens, and we saw it first back in the 60s with some of the volunteers. Some of the this might sound like I'm sidetracking, but it's important, I think. There were people who would come as volunteers, and afterwards they would say, actually, I did have phobias. Actually, I did have obsessions. Actually, I did have anxiety, and it's gone. They didn't, because, and I learned that later when we did genetic studies and investigated the whole population. There's a number of people who would be diagnosed if they came for diagnosis, but they don't identify themselves as patients. And so there are definitely situations where one session without psychotherapy can work, but it's very risky. It's very risky. I don't think it should be done. There should be preparation. There should be supervision. There should be integration. Otherwise, we are playing with fire. We are opening unconscious forces that can be extremely positive, but can be also extremely positive. We still have old limbic animal brain there that's co-involved, and so it needs to be done properly. So evaluating the results really needs to be done, I think, as psychedelic potentiated psychotherapy. Now, I know that it always fascinated me. For example, in Maryland Research Institute, when they did the studies with alcoholics, I think the results were superior. Generally with addictions, it's very difficult to get any lasting benefits, and they did. But the interesting thing for me was where it worked and where it didn't work. And it appears why it was interesting is because I've seen a lot of people in wonderful non-ordinary states of consciousness, in mania, in elation. And I was always wondering, well, they have this feeling of unity and so on. How come it doesn't change their life? And the problem is, I think, with the alcoholics, it turned out that if they came from the session and learned from that, and whatever they learned, they brought into their life, there were changes, and the period of sobriety would continue. Whereas if it was just session, there was no taking out of the learning that took place, then the experience by itself, experience of peak experience, mystical experiences by itself is not enough. It needs to be in some way integrated into life. So there is, I think last time when I was giving the talk in Ottawa, I think I showed the review of the results with psilocybin, LSD, and I think there were some initial studies in MDMA. But keep in mind that the systematic studies have only started in recent years. You cannot really study in a routine practice yet these substances.
Thank you so much, Paul. Wow. I'd like to pass it to Walter, who has raised their hand for a question.
All right, thanks, Karen. And thank you, Dr. Groff, for your time and your commitment and the history of all that you've shared. And thanks for all you've done for psychedelics and mental health in the community. My question follows up a little bit around the future of what's happening in the future right now. I see a lot of this medicalization and the corporatization of psychedelics. And, this is just going to become like another medical procedure, in some of my experiences, and you touched upon it in this place of the unknown or the unconscious or the transpersonal and the spiritual dimensions of that. And what do you may foresee the risks or how we might mitigate the risks of losing those spiritual and transpersonal spaces due to that corporatization and further deeper medicalization of these substances? Thanks.
Well, I see there's two questions. One is really the dangers, and the other one is the question of the medicalization. So the dangers, I think, are there, and they are, I think, substantial things that could derail the movement. I don't think that's going to happen, but the risks are there. There are three major risks, as I see it. Number one, there is a lot of people now, a lot of physicians, a lot of psychiatrists who are started using psychedelic substances without being properly trained, without having understanding, without assuming that it's just another psychotropic, this is just another antidepressant. Look, I have a patient, he took psilocybin, or a patient came from me, took somewhere psilocybin, and tells me that finally he's free of depression. And so I'm just give I don't know, IV ketamine. There is over 450 ketamine clinics in North America that sprung. And from what, of course, COVID, and I have not checked these things, but my understanding is that many of them, you just walk in, pay your whatever, $1,500, and you have a brief talk with someone, you lie down, they shoot you ketamine intravenously, and 2 hours later you just walk. And I think that really troubles me greatly. That could, hopefully, there is enough wisdom in the universe to feel that they will realize that they start talking to people, what they experience, and learning from that. But and unfortunately, some people who are trained are setting up programs, and so it will balance. But this is a danger. The danger number 2 is definitely the pharmaceutical companies. At this point, I think there's 24 or 25 companies that are trying. They see the billions, the potential billions that are there because you have very effective substances. And now, my experience with pharmaceutical industry was probably different from other people, and there are good and bad things. The purpose for pharmaceutical companies is to produce effective and safe drugs, and at that level, you can work with them. And I found them very helpful. For example, with establishing lithium in Canada, they supported it, and the reason was because they saw that it was a very effective substance. But the billions that they see is a big danger at this point. They will eventually, like with car companies, 1900, 110, I think North America, 4, 5 North American. I think it's going to come eventually just to 4 companies. And the third thing is people who are uninformed and uneducated about psychedelics and start using it, and some things go wrong. For that reason, the open, I think, plays extremely valuable service here. And I know that there are also people from Montreal and Toronto connected, so it's not just local, but the education about what the substances are, about how to use them responsibly, and whether you use it for treatment, for self-growth, for spiritual purposes, or recreationally, that you do it responsibly and the right way, and with the help and supervision. Now, the second question, medicalization, I can understand that, there are certain things, I don't know whether I should go into it, but Walter, you disappeared. Are you still there? Yeah, okay.
I'm here, I was trying to have a bite to eat, yeah.
Okay, so I think the medicalization, look at it as a necessary step. The reason why I think the Renaissance is going to continue is because of the medicalization, because these substances are being created as medical substances that have approved efficacy, approved safety, and they will be around. And then we can take the next step: decriminalization, legalization. Obviously, these substances need to be available. Whoever wants, and I mentioned the 4 different, what I see as legitimate way of using, as long as you do it responsibly. But look at marijuana, for example. Why do we have marijuana? Because the majority, the public opinion was that most people felt that it should be legalized. They've seen the nonsenses. This is not true for psychedelics. We have much more education to do. So the only other way you can get it, I think, is medicalize the process. And then when it's medicalized, move to the next step. That's the way I see it. It's just a strategic issue.
Thanks, Paul. That was great.
Thank you so much. Another really interesting question as we dive into some of the more difficult questions here. Sarah has asked, has put this in the chat and said, my first psychedelic experiences gave rise to psychotic symptoms which fully resolved and became meaningful and symbolic parts of my healing journey through ongoing psychedelic use. I'm fairly certain I would have developed a full-blown psychotic disorder had I not ignored medical advice and trusted my instinct to continue working with psychedelics. This is a big question, but where do you draw the line between people with psychotic symptoms who should and who should not use psychedelics?
Well, the problem is that what I have learned is that all these terms, psychotic, psychosis, paranoia, psychotic, have been essentially created over a century ago in a very different environment. At that time, I think, people needed to put psychiatry on the same footing as other disciplines. They needed to classify. And they classified depending on the people who were in the hospitals where they could watch them. And so when you came to the hospital and you were diagnosed psychotic, it was not just because of the symptoms of psychosis. It was because they could not keep you anymore in the village or the city. You were completely non-functional. But that's, I don't know, 2, 3, 4%, maybe less, of people who come with symptoms now. My experience is that symptoms and psychotic symptoms by themselves don't tell you whether you are healthy or not. It all depends what you do with the experience, how you understand it, how it influences or does not influence you. And so, yes, I think if you will find it, of course, in some of the guidebooks, if you have psychotic symptoms, don't use psychedelics. That makes perfect sense. If somebody comes for a weekend session, and that's the only contact you're going to have with that particular situation. If you have psychotic symptoms, you shouldn't, because it may take 2 days, 3 days to integrate. When we did holotropic breathwork for people with severe mood disorders, we had a team and in the private house, and we had enough people to stay with the person up to 3 days to integrate. But that's not the usual situation, So I think the advice you got was the right traditional advice, but I think the advice should be done depending on the individual situation, on careful assessment, getting careful, know the person. I find that it takes me at least 4 hours to get some understanding of what the issues are and what can be done. But so the answer is a little bit like a lawyer. It depends.
Thank you. Fair enough. We're still learning. Paul, if you feel comfortable, we have been asked to ask you, would you be willing to describe...
Not ask anything that I would incriminate myself.
Well, a little on the nose. So someone had asked if you were interested in describing your most profound experience with psychedelics, which you don't have to answer because we have lots of other cool questions to get to as well.
Well, look, it's simple. I had 5 sessions during my training that were obligatory. But the problem for me is I had very profound experiences on psychedelics. I had profound experiences in deep meditation. I had profound experiences of void in a guided group meditation or group, I don't know whether it was group hypnosis. I had profound experiences in holotropic breathwork, and so I don't know how to compare it. I mean, certainly what I value most, and I say I had that on psychedelics, and I had that in non-ordinary states of psychedelics, that feeling of connectedness with everyone, the experience of being a drop of the human ocean, the beauty of that, and the love that one feels in that experience. Those were most valuable, but that's not tied up with psychedelics. That's part of, that's at the depth of human consciousness, and you can get there in different ways. Certainly, as part of the process, the psychedelics are very useful augmenter, but it's not the only way. I don't know whether I'm answering your question sufficiently.
You are. Well, on the topic of connection and love,
The interesting, I can say one quick thing. What fascinates me also is that the answers that we get from exploring deeply human consciousness has over the past century come up from all hard sciences in the same way that suddenly, for the first time in history, spirituality and science, psychedelics and science have the same language, have the same connecting, same common denominator. I think that's extremely valuable.
It's truly amazing. And on this topic, Amy and I were conspiring in the background and have decided to ask Catherine if she's willing to please ask her last question, the fourth question, to sort of tie these themes together and bring us to what we hope will be a lovely place to wrap up. Catherine, we're putting you on the spot, but would you like to ask question number 4, please?
Oh, I'd love it. I just love it. Right. Well, okay. It's a long question. Well, the question comes at the end. I remember, Paul, the first time I walked into your office. I could feel love as kindness. I didn't have the courage to ask then, but I would like to ask you now so that we might all benefit. I am starting to learn about love and living in the present from Eckhart Tolle. But I find that you seem to embody some of these principles for living with love and kindness and compassion. So the question is this something you have learned how to do? Or was it always true for you? And do you have any advice for us who want to walk in the world as a loving presence?
How much time do we have left?
10 hours?
I'm so glad that you felt that way when you came to my office. That's not the way that people usually describe their experience when they come to a shrink. But I'm glad you felt that way, because I certainly, that's what I wish for people to experience.
Can I interrupt for a minute, though, that I didn't say anything until I met 2 other people who had the same experience. And then I thought, aha, okay, so now it's not just me.
Yeah, I'm not sure whether learning is the right way to describe it. I think it comes from the experience in non-ordinary states of consciousness, and in the simplest possible way. Because of the experiences I had in the past, when you came, I had a feeling, in some way, you are part of me, and in some way, I'm part of you. And how else can I then? It's a most selfish way to approach it, that way, why would I not be kind to myself when it comes through the door? Plus, it's also very selfish for another reason. When you listen to people who had near-death experiences, they tell you that when you leave the body, eventually it comes a point where you go through life review. And that's another reason why I think most of the memory is in the field outside of brain, because I can't imagine how any substance could save all the experiences from, I don't know, it's going to be 85, 90, 95 years of life. But when that review comes, you go through all your lives, through all the experiences, and you see it, not just your memory, but also how the people you met. So we're going to meet again up there. And I want to have an easy time then, Plus, they often experience not just the person that they encountered, but also the people, their family or other people, if they get affected by the interaction. So, it's more of a reflex of kindness, compassion, caring, rather than learning.
Thank you.
You're welcome. So I think if there is an advice that I have to give, have a peak experience, have a mystical experience, whichever way you can get there.
Well, thank you so much for that moving answer. We do have a couple questions, and I see that David's hand is up. David, would you like to go ahead and ask your question?
Yeah, thank you very much. And Paul, thank you very much for all your hard work in this field. And my life has changed. I'm actually able to live a life because of the medicine and doing the work with therapists. I do have a question regarding repressed memories, on different techniques that you may suggest on accessing those memories to heal from them while in an altered state in a therapeutic session.
To offer specifically what to do, I think it would really require some time with you to see what troubles you and why you go that direction. Generally speaking, the simplest thing I found is kind of a deep relaxation and deep and superficial hypnosis. I found that helpful, for example, when people come for a consultation and I feel that even after 3 or 4 hours, I don't have good understanding of what some of the issues are behind that. I would use the hypnosis and exploration and deep relaxation. Then, of course, meditation, deeper meditation, guided meditation can bring it. As I told you, I had very deep experiences in guided group meditation, and a number of things completely repressed came out. And the next thing is, of course, the psychedelics, properly set up as part of psychological support. The mind usually brings to the surface what you need to know, and that can be also part of your intention, before the session, that you want to learn. You want to learn what you need to learn about where the pain comes from.
Thank you. Thank you very much.
Well, it's 2:29, and I'm feeling greedy as I see one last hand up. So Anita, if you'd like to ask a fast question, perhaps Paul would be willing to give you a rapid fire answer.
I guess I'll make this fast. It was just more, I have more for like would you know of how psychedelics could help more of a mood disorder that has like a physical cause behind it? Like
So
say extreme anxiety or depression due to like a chronic illness or I guess accident?
how this, whether psychedelics help severe anxiety and some pain that comes from an accident?
Or like an illness, if you are now like, if you have like a life-threatening illness and now you're extremely anxious of your own body, would there be any like, is there any information or any sort of like guidance on how psychedelics could help healing from that?
Yes. Oh, there's a lot of information about life-threatening disorders and also end-of-life experiences. For that, I think the psychedelics are very effective. First of all, I think my brother's book back from 1972, where he dealt with, let's say, cancer patients and other life-threatening illness. We are also hoping with Jennifer Clinton in the fall start working with psilocybin, got a permission from the government for some life-threatening disorders to help. What it does, what the potential is, usually the psychedelics can, because of the deeper experiences, one loses the fear of death from severe life-threatening illness. The anxiety is reduced significantly. And with some of the psychedelics, particularly with LSD, there was also experience with significant reduction of pain that may be associated with the life-threatening illness.
Is it like necessarily like, is it like a one-time thing, or do you need multiple sessions? Is there any way you treat it differently than say just a regular anxiety?
Usually, several sessions would be preferable in that situation. It may resolve in one session, but I would not start with that assumption. You could be disappointed. But I think it's better to plan for several sessions, and if it's one or two, then good, better for you.
Okay. Is it different from regular anxiety though? Like, would it be like in a psychedelic setting and you're using psilocybin to treat, say, somebody who's like anxious because they have cancer and like they're facing their death? Would that be different from, say, somebody who's just using it to treat anxiety in general?
I would assume that it would be easier to deal with anxiety. That's part of just situational stress as compared to some chronic anxiety that's been there for a long time, and one might need to go quite deep to find the sources, find the roots of that.
Okay.
Thank you. Thank you so much. Thank you, Anita, and thank you everyone for your questions. I think we can all see just the intensity of the excitement that we all have about this topic and how important it is to all of us personally in our lives. So really how much it means to us that you took the time today, Paul, to share your ideas, your knowledge, your learnings. It just means so much to us to be able to learn from you, for everything you've contributed to the field. And I just want to thank everybody for taking the time to join us on a Sunday, like Paul said, on the long weekend. It means so much to us. Thank you, Catherine, for bringing your energy and the beauty of your relationship with Paul today. Thank you, Amy, for your organizing help. And just want to let everybody know that should you wish to continue the conversation, we have a discussion circle coming up with Open this Wednesday evening. We have bi-weekly discussion circles, integration circles, a Facebook page, lots of opportunities to keep connecting. With that, 2:34, so we're not doing too horribly. I'll drop some shameless promotion. in the chat here if you want to learn more about our community. So thank you very much, everybody. Have a wonderful rest of your afternoon and take good care. Hope to see you again.
Thank you for
Thank you all so much. That was great.
Goodbye.